this video we are going to talk about the first stage of labor. Now, the first stage of labor starts with the true labor pains and ends into the cervical dilatation fully. The full cervical dilatation means 10 centimeter of dilatation. Now, the process of first stage that starts with uterine contractions ends with cervical dilatation full. The events in this stage is not equal all the time. That's why we divide this this stage into two different phases. The first one is latent phase and the second one is active phase. Why we divide this thing? If you see in the initial events, in the initial time of the first stage, we need four things that should be fulfilled. The first thing is what? We need adequate uterine contraction. We need cervical effacement. We need initial cervical dilatation. We need bag of membrane. So these four things, it actually takes time. It's not a matter of 2 or 3 hours or even 4 hours. It's a matter of at least 12, 13, 14, 15, 16 up to 20 hours. So when we talk about the first stage of labor, this big phase, initial phase, is very important to establish a labor. But once the labor is established, once the labor enters into the active phase, then it is very speedy. It takes the speed. So for the sake of definition, we have told that the latent phase is what? Up to 5 centimeter of cervical dilatation, and the active phase is after 5 centimeter dilatation. What is the normal ranges of this all? The latent phase, if we talk about nulliparous woman, average latent phase is 12 hours. But yes, it can go up to 20 hours. When we call the prolongation of latent phase in nulliparous woman, this means the latent phase is even more than 20 hours. The values for the multiparous woman is what? 8 hours. I have told you the very concept, but again I am telling the concept that the latent phase is all about cervical effacement, initial cervical dilatation, and setting of very rhythmic, regular, intensive uterine contractions. While the active phase is what about? It's about full cervical dilatation. It's all about cervical descent, fetal head descent into the pelvis and passing of the head into the pelvis. This is what is active phase. So, what is the normal range in active phase? The rate of cervical dilatation, it should be minimum 1 centimeter per hour. Okay, it should be more than 1.1 centimeter per hour. If we particularly talk about nulliparous women, it should be more than 1.2 centimeter per hour. If we talk about multiparous women, it should be more than 1.5 centimeter per hour. That means that the active phase in multiparous women should be very quick. Okay. When we start considering this active phase after 5 to 6 centimeter dilatation. So you know this thing, that if the rate is minimum is 1 centimeter, then the active phase should complete in maximum 4 hours, 4 to 5 hours. Preferably in nulliparous woman, it should be at least 2 to 3 hours, and in multiparous women, it should be maximum 2 hours. Now, what are the reasons for these prolongations? For latent phase prolongation, as we told you that in nulliparous women more than 20 hours, and in multiparous women more than 8 hours, sorry, more than 14 hours, it's when we call it as a prolongation of latent phase. And the reason behind that is obviously not good cervical effacement, poor cervical dilatation. The uterine contraction are not true, they are false. And again, what is the treatment? Well, it's not a very dangerous situation. You need to do is monitor the fetal and mother health in the vitals. You need to maintain hydration of mother and fetus. Give the mother fluids, IV fluids, along with monitoring of the fetus. Okay. And when you find it that the labor is not true, it is a false labor, you need to do adequate rest to the woman. You need to give muscle relaxants like Buscopan. Now, if the active phase is prolonged, then that is a dangerous thing. When the active phase is prolonged, that means that there is something that creates the problem between the head of the fetus to pass into the maternal pelvis. So, what are the causes? It can be cephalopelvic disproportion. It can be bad fetal positions like occipito-posterior position. You need to rule out all these things. Once you rule out all these things, now you know that the only thing is what? The adequate uterine contraction is not there, or the labor is not actually very set. So what you need to do is you need to do 2 or 3 things like artificial rupture of membrane. If you do artificial rupture of membrane, that makes intense uterine contraction. The contractility of uterine contraction is also increased, as well as the duration. So the labor actually sets in. If you find that the uterine contractions are not adequate, you need to add oxytocin. But yes, continuously you need to monitor the fetal status. When you do artificial rupture of membrane, what you find is you can actually see the amniotic fluid, whether that is meconium or not, the bloody mucus or not. Everything you can see, bloody amniotic fluid, everything you can see in this amniotic fluid once you do rupture of membrane. So this is how you manage the active phase of labor. In some conditions, that happens is arrest of the labor in first stage, and that is, my friend, very big problem, and that is very big dangerous also. When you call it that the labor is arrest in only first stage, because the arrest of the labor, it happens mostly in second stage, but only sometimes the arrest of the labor happens even in first stage. And when you call it that it is an arrest, first of all you need to remember this thing: the cervical dilatation should be at least more than 6 centimeters. It should be artificially ruptured membrane. If the uterine contractions are not good, you have to add the oxytocin. If all these measures you have already taken and still the labor is not progressing, then you make the diagnosis of arrest labor. And the management and the treatment of the arrest of labor is nothing but the cesarean section. Meanwhile, you are preparing for the cesarean section, you need to remember that you need to continuously monitor the fetal status. Meanwhile, sending the patient to the OT. This is, my friend, clears the first stage of the labor. Thank you.